Hey guys, this is Press Maycock with Biotics Research, Northern California. As many of you know, I'm hosting Dr. Brett Wisniewski on March 16th. We've got a one-day seminar coming up, 8 CEUs and CMEs and organic lunch all included. And I really pride myself in bringing in really high caliber speakers. And many of you don't know Dr. Wisniewski. So we decided to hop on a Zoom call and just chat it up. I asked him if he wanted to do a video. He goes, I don't want to do it. I don't want to do a sales pitch. And I didn't blame him. So to that end, I wanted to introduce you to Dr. Brett Wisniewski. You're practicing in Colorado, right?
Yeah, Northern Colorado, Berthoud, Colorado, really small town, just south of Fort Collins, which most people probably familiar with. I think it's one of the top rated cities to visit each year. I don't think it's anything special, but maybe that's just because I've been there a bunch.
Yeah, absolutely. Well, tell us a little bit about your practice. We spoke a little bit before we push record here.
Yeah, sure. So the practice itself has been in this very location for about 28 years. I've been out here for, I would say, about 10, so for about a decade. And it's I guess it's considered an integrative clinic. We do everything all natural in our particular clinic. We're not opposed to pharmaceutical intervention at different times, but we don't actually facilitate that here in our practice. We have some colleagues that we refer to. So I think we're kind of unique in that sense, if in the term of integrative, right? Most people are thinking that there's DCs, MDs, PTs. And most of our practice is based on internal disorders, chronic disease, autoimmune pain syndromes. We do some alternative cancer therapy, usually a hybrid model with some of the local oncologists. And we have right now we have 3 full-time practitioners. I myself and Dr. Kleber, which some folks may or may not be familiar with, we do teach the DAPC program, which is the Diplomate of American Board of Chiropractic Internists. Wow. I've been doing that for about a decade as well. Dr. Kleber's been doing that for many more years than I. But that's a program that we run online. And that's a kind of a soup to nuts program. We go through everything from history taking through the physical exam, and then we do break down the idea of implementing some of these chronic disorders into what's considered a functional medicine or an integrative practice, usually breaking them up into body parts and or different kinds of systems, such as the immune system or the aging brain. We have a whole section on autoimmune disease. We have 2 courses on cancer. So it's been a lot of fun. And I think that's something that also keeps our clinic very current. We're kind of forced to look at all of the new data that comes across all of our desks that a lot of us just say, read later or put it into the trash. We have to read those things because it's something that either our patients are going to ask or our students are going to ask about. So I feel like that's one of the ways that I learned about some of these oddball things is I do have to open up each and every email and just at least skim it, see what's out there in the world of natural and traditional medicine. And, then charged with figuring out how do we apply that to clinical practice? Because that's what's really important. You could sit in an 8-hour seminar, you could even listen to a 1-hour webinar and be blown away. The speaker is very prolific. They have really good things to say. They were showing you all this new research, whether on human or animal models. And then you click end and you just sit there and you're like, well, what do I do? It was like, wow, I wish I was that person, or I wish I was as smart as that person. And I found myself in that situation when I first graduated. I was going to all these seminars trying to learn. And I was like, I was enamored by these folks. I'm like, oh my God, you have all of this information in your head. You got this great presentation and I'm going. And then hour 8, thank you everybody for showing up. Thank you for the speaker. We hope you guys all enjoyed. Have a great day. 10% off your products on the way out. And I get in the car and I'm like, I don't think I have got any of that.
What just
and
happened?
If I did,
right?
And if I did, like, what do I do? Like, what, Monday morning I get into practice and it's like, okay, we talked about lipoic acid for neuropathy, and I know I have to dose that pretty high, so I got that. But then we talked about, red light therapy or infrared. I don't have one of those devices. Can I use the lipoic acid? Will it work if I don't have the infrared? Am I supposed to test their insulin now? And then you mentioned C-peptide, but they're on insulin, and it's like, oh my God. So when I started, getting into education, I wanted to make sure that I created presentations that were complex in the sense of the information that I'm giving and using those things as more of a resource or a reference, but breaking it down in such a way that you didn't feel like I did when I left those classes, and that you did leave with, oh, okay, here's kind of this algorithm that I can follow. If patient comes in, and if we're talking specifically about mood disorders, what am I looking for? What are the questions that I ask? Do I care if they're on medication? Yes or no? Did medication work? Is that important to me? Yes or no? Okay, now what tests do I run? There's genetic tests out there that look at the pharmacokinetics and the different ways that things are processed in the body as far as some of the pharmacology interventions. There's going to be nutritional interventions I can use. Which ones could be mixed together? All those things can become very, very complex, but the idea is to break them down and make them so simple. And the way you make them simple, in my opinion, is you just go through the basic mechanisms. How do these mood disorders arise? And especially with the context of this conversation, is looking at the immune system, looking at the inflammatory response. I think it's well known now that most of these mood disorders appear to be some sort of neuroinflammatory process. And but what does that mean? Like, what does inflammation mean? Right? I remember in school, everybody's anti-inflammatory diet, put them on anti-inflammatory herbs, knock down inflammation and knock down pain. No one ever actually told me what inflammation was. I was taught heat, color, and swelling, right? Heat, redness, swelling. That was inflammation. If you really break it down, inflammation is just the immune system talking. So if you want to kind of quell inflammation, you have to look at why the immune system is active. So looking at the different things that trigger the immune response, and in this case, it'll be different pathogens. And it's also going to be going through the stress response. And there's a lot of data that looks at early childhood trauma and how that translates 20, 30, 40 years later that in the patient that's in front of you. Because that's when we meet them. We meet them when they're 50. We meet them when they're 60, when they've already gone through decades of pain and suffering and anxiety and drug trials and all the different things that all of our patients have been through. And no one's asked them, what was your childhood like? And I'm here to tell you, you don't need to know the intricate details. I don't want to know the intricate details of some of these horrific things that people have been through, but it is important to find out what they've been through and for how long, because it's predictable on how their immune system will function decades later. And that saves you a ton of time, and it saves them a boatload of money, and you can get to work right away. So, looking at things like the different organisms that can trigger the neuroinflammatory response directly, indirectly, looking at some of these trauma histories and these different patterns that have been produced in the patient. And then, looking at the gut microbe, I think most folks are pretty well versed in that by now, but seeing how that translates more directly to some of the neurochemistry and different ways that we can change that right away without having to go through a 6 to 12 week gut cleanse protocol with reinoculation. And yeah, that stuff's fantastic. I'm not poo-pooing any of that. I think we should know it. There's definitely people that need that. But when you got somebody in front of you that lost their job because they literally cannot get out of bed in the morning because they're riddled with anxiety, they don't really give a shit about your 12-week gut protocol, right? They want something right now. I need something that makes me feel better now. We'll worry about the problem in the future. What's right now? So we'll go through things that help these people in a more supportive way initially to make sure that they are getting a response within a few days of leaving your office. Anxiety's coming down, depression's getting a little bit better. They can get to the gym, they can be more active, they get more sunshine. But then we also are going to talk about the basic constructs on how these things evolve over time, and looking at different patients based off their sex, male, female. They're going to have different kinds of responses when it comes to moods, depression, anxiety. And then we're also going to look at their history and see where they came from, what's their background, looking at vertical transmission of stressors. So if mom was stressed while carrying them in utero, that also has a really, really interesting expression as the patient ages. Also, how their immune system functions. You'll see people are more vulnerable to rather innocent infections if they have a certain stress mechanism, and that may have been inherited, or maybe that's something that was self-induced as an adult with a poor diet or maybe a stressful job or relationship. So all that being said, I think I like to have a lot of fun. I think life's stressful enough. We all deal with a lot of BS, especially the last few years. So I like to keep things really lighthearted. I like to take complex conditions and make them as simple as possible. And I also like to keep the presentation a little more on the fluid side. I definitely have some material that I think we need to get through. Once you guys download the slides or you receive the slides, you will see that there's many hundreds, and that's by design, because a lot of those are going to be a reference that you can always go back and thumb through, even if we don't get to cover the material. But I'd be interested in knowing what the folks want to learn, right? I mean, I don't have the answers to everything, but I have researched this topic quite a bit. I've applied it to clinical practice for nearly a decade at this point in time. And I have a lot of things I'd like to share. And I'd also like to learn from you guys. You know, there's a ton of times I come away from these weekends and I'll talk to my wife. And I'm like, I think I just learned more than they did, you know? So we're all on the same level. I just happen to, be hired by Biotics to stand in front of you. So I am excited to get together. It's been a little while since I've been able to travel in this capacity. So I think this will be a lot of fun.
That's great. And I know for a lot of practitioners that Biotics is a new line for them. And I know we spoke before, you've got a multitude of lines, and all the more, serious and experienced practitioners they grab from this line and that line. And can you speak a little bit about Biotics and what you think about that? Why do you speak for them?
Yeah. So, just full transparency, we have probably high 20s, maybe 27, 28 different product lines in our office, possibly more. That's just off the top of my head. So Biotics is by far our only product that we use. I would say it is our number one product as far as shelf space. So we do like to use their products when possible. And the reason why I reach for Biotics whenever I can is I would say cost comparison. I was a sales rep for Biotics way long ago, so I've had to do a lot of cost comparisons for different clinics, and usually cost per dose, Biotics always wins. It may not be the exact formula that you're looking for, but when you break down the ingredients, you will find that usually it's the best bang for buck for you and for the patient. I like that they're gluten-free. That's huge for me personally, as well as a lot of my patients. I've been to the facility as a rep and as a practitioner, and I'm always flabbergasted by, it's basically just a big lab that happens to make supplements. I mean, there's negative pressure rooms, there's clean rooms, there's rooms you're not even allowed to look in because of the different manufacturing that they're doing. They mill their own machinery because it's so unique. There's no company that actually makes it. Their water filtration system would rival any of the cleanest water filtration plants you would ever find. I mean, it's just, I didn't realize how much goes into the processing of properly making supplements. So from that day forward, I was like, whenever I can, I'm going to use Biotics. But I know, and the owners will tell you, that they don't have every product. So it is important that we talk about some of these other product lines or some of these other combination products that are available. Or being frank, sometimes Biotics goes on back order. Sometimes every company goes on back order. So it is nice to kind of have a backup plan. And that was really important with COVID. There was a lot of times Biotics pulled me out of a hole. They really saved me because they wound up having the product that I was looking for, and vice versa with some of these other companies. Yeah. So we have to be flexible. But I would say that when it comes to quality, when I start treating patients with these urgent care infectious disease, we're going to talk a lot about vitamin A. I don't use vitamin A from any other company. Now, if it's in a product, that's one thing, but actual just straight vitamin A. And when we're going through vitamin A burst therapy, which we will talk about, which is when we're using, 3, 4, 500,000 international units of vitamin A at a time, I will only go with Biotics because that's the only label I can trust that drop of vitamin A has that amount. And that was exposed a couple of years ago, not just with professional companies, but there was a group going around buying supplements and testing them and finding wildly different amounts of nutrients in the product versus the label. So, and I'll just be honest with you guys. I'll let you know what I use and when. Biotics doesn't have any natural hormone products beyond, things like pregnenolone and DHEA, which we will talk about. DHEA has amazing anti-inflammatory effects if you use enough of it. And we'll talk about what that dosage is that I find is effective in clinical practice and what the research also supports. So sometimes we got to use things that have progesterone in it, right? And there's companies that have that, or Biotics doesn't make suppositories. And there's companies that make those things too. So we're definitely going to concentrate on the Biotics products line. And that's only purely because I use Biotics products. It's not because Biotics hired me, but I will be open and honest whenever I feel like there's another company or brand that would fill that hole and or has a product that I feel like, hey, you have to use them. They just do it right.
That's great to hear. I've got some really, really smart practitioners out here, and the holistic profession in general, it's very high integrity. And even as their rep, I'm like, I'm going to give you all the information you need to make a well-informed decision. But at the end of the day, it's your patient, and their outcome, their positive outcome is a positive outcome for me.
Yeah.
Yeah.
Yeah. And I speaking for, or, running the DAPC program now with Bill, we have to talk about every company that's available. I mean, it wouldn't be fair to have a 300-hour diplomate program that is just on company X. It doesn't make sense either.
It doesn't make sense.
Because company X doesn't have everything we want. So I'm fairly well versed in a lot of the really, really popular companies, and happy to talk through some of those options with practitioners when necessary. But Biotics is always my go-to. I know the brothers that own the company. They've been amazing to me. They've been amazing to the industry, probably more so than people even realize.
Very high integrity.
They're influencing on different legislation, their background on research with certain raw materials. I mean, there's products you get frustrated about that Biotics takes away, and you just figure it's a money thing. But then you go find out that they couldn't find a good organic source of X without, arsenic.
Their quality standards. Yeah.
Right. And that's why your rice protein went away. And you're like, well, why are all these other companies still carrying rice protein? One of two things. They either did find a good source of rice protein and it's organic and doesn't have arsenic in it, or they don't test for it. And that's something that you have to ask yourself if you're comfortable with. So it's I always just, I know I said it, but yeah, they're my go-to.
That's fantastic. Yeah. Well, for the sake of time, I know we want to do our intro video. I want to just remind people and invite people. I want to share this practitioner with you. I'm excited about it. I'm excited about this topic. It's your infectious personality, rethinking mood disorder treatments and infection links. We always have a good time at our seminars. We're happy to welcome Dr. Wisniewski out here. I'm inviting you to join us. Thank you, Dr. Wisniewski, for taking the time to share a little bit about yourself and how you came to be and what we're going to expect. And for those of you who, wherever you see this video, there'll be a link somewhere to register. Here, down, I don't know. But Dr. Wisniewski, thank you so much for your time.
Yeah, no, I appreciate you and looking forward to it for sure.
Awesome. All right. Cheers.